Good morning, Chairman, Ranking Member, and members of the subcommittee. My name is Marcie Strouse. I'm a partner and benefits consultant at Capital Benefits Group in Des Moines, Iowa. I'm grateful for the opportunity to testify today on behalf of small business owners nationwide who are struggling with increasing healthcare costs. For 4 decades, the cost of health insurance has remained the #1 problem for small businesses. The problem is now a crisis, with skyrocketing costs crippling Main Street. In fact, 98% of small businesses report that healthcare costs will become unsustainable in the next 10 years, threatening their ability to survive and remain competitive. This is why it's important that lawmakers focus on policies that empower small business owners and their employees with more choice and control over their healthcare decisions. For 20 years as a benefits professional, I've had the privilege of directly helping small business owners throughout the state of Iowa. I am boots on the ground, sitting across from business owners throughout the state. As employers look today, we're trying to find ways to help solve problems. Healthcare affordability is particularly important for my family as well, as we've experienced firsthand the importance of having access to quality care. We have 3 awesome children, Sid, Ella, and Libby. At just 7 years old, my twins were diagnosed with a neuromuscular disease, and this experience changed me forever. Since then, I have worked closely with the Muscular Dystrophy Association and was appointed by Governor Kim Reynolds to the Iowa Medical Assistance Advisory Council, working with Medicaid and MCOs in the state. I interact with small business owners daily, and I am a small business owner myself. I can tell you firsthand the overwhelming stress and anxiety employers are feeling right now. Small business owners care deeply about their employees, customers, and communities. They are constantly worried about recruiting and retaining employees while keeping their businesses afloat, and this is particularly challenging in this environment with sustained high inflation and acute workforce shortages. Employee benefits have always been important, but are even more crucial now. Our clients are more eager than ever to offer great benefits and to meet the needs of a diverse workforce while remaining competitive. But unfortunately, many lack the options. Many of our clients are forced to make tough choices every day. Some go without pay to keep their employees cared for and working. Others are forced to raise their prices or take a profit loss to contend with rising healthcare costs. For instance, in Polk County, Iowa, average small business premiums for a family have increased 85% in the last 8 years. For context, my family is currently enrolled in an individual grandmothered plan through Blue Cross and Blue Shield. We have a $2,500 deductible, and our monthly premium is $903 for our family of 5. A similar Affordable Care Act group plan today would be $1,952 in monthly premiums. The status quo is unsustainable. I hope this committee will advance policies that promote affordability and increase choices for small businesses. The following reforms would be a great starting point in providing much-needed relief for many of our clients. First, Congress should significantly expand coverage options, allowing small business owners, regardless of industry, to band together to form association plans and give them the same bargaining power big employers have. Congress can also expand protections for small business owners who choose to self-insure, expanding access to stop-loss and reinsurance. For instance, can reduce financial risk, enhance plan design, and increase the business's competitiveness. For an example, a recent client with 3 members was able to save $5,000 annually through a level-funded reinsurance plan. They were also able to lower the out-of-pocket maximum and co-pays for their employees. Employers can also benefit from greater transparency and competition in the industry. The system is too opaque to the detriment of employers. Increasing transparency in the pharmacy benefit manager markets and reining in healthcare hospital monopolies that engage in anti-competitive practices is key to lowering the cost of care. Lastly, lawmakers should reduce burdens on employers by streamlining and eliminating unnecessary reporting requirements. In conclusion, small business owners deserve relief from rising healthcare costs. The folks that I work with are not distant CEOs, but rather hardworking Americans betting on the promise of the American dream. They are in their communities. They go to church and school activities with their employees and their neighbors, who are also their customers, who they care deeply about. If small businesses thrive, we all thrive. Thank you for your attention to this important matter and for allowing me to testify today.
Thank you, Ms. Strouse.